Realignment osteotomies and procedures are a particular passion of mine. We are all born with a certain amount of twist in the hips and a certain amount of twist in the shin bones. When this is excessive or not within the normal range, this produces all sorts of abnormal forces that can lead to ongoing pain, and the knee is a particular victim of this. Also, because of the abnormal twists, the kneecap can run over the knee in a very different position to what was intended by nature, and that in itself can damage the cartilage and cause ongoing pain. There are other conditions where the anatomy, i.e. the normal grooves and curves of the knee, aren't as well developed, and there's separate procedures for that. The other aspect of realignment is, rather than, if you were to draw a plumb line with someone standing from the center of the hip to the center of the ankle, it should be more or less within the middle of the knee. But for a number of reasons, either just because someone was born like that, or the inner or outer bit of the knee has worn down in preference to the other, you can get knock knees or become bow-legged. Now, traditionally, the solution has been putting a replacement in. However, that has its own complications, and it's something that you wouldn't want to do in a young person, because a knee replacement is a mechanical device. It will start wearing. Technology in knee replacements has improved vastly, and they are lasting much longer, but still they do have a life. The younger you are, the more knee replacements you might need in your lifetime. We have good technology for the first redo. Technology for the second redo is again getting better, but certainly if you were coming up to the third redo, it's not great at all. So having a knee replacement under 40 is a particular disaster. Under 50 is not great. Under 60, you'd want to try and avoid if you can. And over 60, it could actually be a better solution in certain people. And sometimes realignment wouldn't really help. Or then the choices come between realignment surgery or partial knee surgery, and you'd have to go along the merits of each. But certainly for the younger age group, where you'd want to do everything to keep the knee, i.e. biological treatments, you can realign the knee so you can restore how the weight goes through the knee back to its center, or sometimes just to the other side. If the cartilage on one side is okay, the cartilage on the other side is worn out, you can just realign it so you've got a few more years with the good cartilage taking most of the load. So if you take an example of a tire and you've got wear just on the inner half, it's like readjusting the camber, so most of the road contact is with the part of the tread that's completely full. Not that I'm asking anyone to adjust the tires so that they run on the edges, but that sort of gives the example of what we're trying to do, just realign the knee. So you've got a few more years before you need to go for a knee replacement, and having an expectation of 10 plus years after realignment surgery before you need any sort of arthroplasty or replacement is not an unreasonable ask. And then the other group with the twists, realigning them can actually completely change their life. I had this one now as a nurse, was a student nurse at the time, that was in so much pain, couldn't go out, didn't really do any socializing, found any time in the wards really difficult. One of the things I remember she said is that she wouldn't dare wear anything with a heel on because it hurt her knee so much. We went through our investigations, we found what the problem was with, and we realigned her. And I remember halfway through the treatment, her walking into clinic with the highest pair of stilettos you can imagine, completely pain-free. And since then, she's been hiking in the pool, she's done all sorts of things. And you coming back to what makes me passionate about orthopedics, it's great seeing someone like that being able to find out what the problem is, realign them in this case, and just give them a normal 20-year-old life back. In terms of length of the operation, it all depends what it is that needs realigning. And that is a very individualized surgery. So I can't really answer that. So it could be from under an hour to more than 3 hours. It all depends on exactly what's needed. Post-operative recovery time can be significant, and again, it depends on how much has actually needed to be done and the method of realignment, which needs to be fine-tuned for everyone. For straightforward realignment in terms of trying to avoid an arthroplasty where just one side of the knee is gone, then one can expect to be in a brace for maybe 3 to 4 weeks and be walking hopefully normally in 8 to 12 weeks. Depending on the job, this could be practically within 4 weeks or so when they can go to a desk-based job. The more elaborate and more extensive realignments will obviously need more time, depending on how that realignment has needed to be done.